Yeah, Doctor.
Okay, thank you. Dr. Saravanan.
Vanakkam. I'm Dr. SARAVANAN Ramalingam, Governor of New York, New Jersey, American Tamil Medical Association, and the part of the COVID-19 Tamil task team. On behalf of American Tamil Medical Association and COVID-19 Tamil task team, I welcome everyone for this webinar today. And I sincerely thank the speakers and the viewers spending your time on a weekend to come here and give your opinion to educate everyone. And also, I wholeheartedly thank you for your sacrifices during the COVID time. Without going much into detail, I'll give it to Dr. Mupana to continue the meeting. And I'm during all these meetings over the last 2 years, we learned a lot of things, and I hope this meeting also very useful. Dr. Mupana, thank you.
Thank you, Dr. Saravanan. Namaste to all of viewers, and good morning to all the viewers in US. My name is Saraswati, and I do pulmonary critical care here in Boston. And now I'd like to invite Dr. Dinesh Patel to say a few words, and then we'll hand over to Dr. Pramit, Mr. Pramit, so for introduction of the other panelists. Dinesh bhai. He's been very instrumental in encouraging all the webinars, and Dr. Dinesh Patel has been my mentor and my guide here in Massachusetts and also in the US. And I sincerely appreciate all that you do for us. He brought so many speakers on this panel. He gave me leads on so many speakers. And this webinar is also, it's because of you, Dinesh bhai. So thank you very much. Thank you for all that you do.
Well, I'm very honored that we've been chit-chatting and talking. I think this is a wonderful thing to hear that ATMA and Saraswati are joining together. The Saraswati, the goddess of education, and ATMA has been doing this for the last 2.5 years. Wonderful education, bringing all kind of doctors from all disciplines all over the world. And although I'm an orthopedic surgeon, I'm still excited to hear those wonderful things coming out of Goddess Saraswati's mouth, as well as all the others who have been doing wonderful things. So I also like to compliment our old friend Pramit, the real friend from here in Madhya Pradesh, and we're doing wonderful things to promote Indo-US relations and helping each other. Anyhow, I'm honored, Saraswati, that you asked me to say a word or two, but it's wonderful. It's the commendation goes to Atma and Saraswati for bringing this wonderful seminar for all of us. Thank you again.
Thank you. Thank you, Dinesh bhai. Thank you very much. For everybody who Dr. Dinesh Patel is a arthroscopic surgeon, and he brought the arthroscopic procedures to Mass General Hospital and to the US initially a few decades ago, and I think everybody followed after that. So thank you, Dinesh bhai, for all your inventions and everything else in orthopedics. We appreciate that very much. Thank you. Pramitji, now on to you.
And I will just like to add, Suleman Saab and Professor Singh, that Dr. Dinesh Patel has a good connection with Madhya Pradesh. जब अर्जुन सिंह जी जब चीफ मिनिस्टर थे, तो उनके वाइफ के ऑपरेशन के लिए दिनेश भाई को विशेष रूप से अमेरिका से इंडिया बुलाया गया था, and he has operated on Arjun Singh ji's wife when he was the chief minister. And there is a lab on Dr. Patel's name at Harvard at MGS. So it's a real pleasure to have Dr. Patel with us today. Thank you, Dr. Dinesh ji.
That is great.
And he also operated on Indian cricketers.
Yeah, Kapil Dev. Kapil Dev was also, there are many senior people who have been operated by Dr. Dinesh Patel, and Dr. Dinesh Patel is one of the most sought after orthopedic surgeon in New England and in America. Thank you, Dinesh bhai, once again.
Thank you. Ramadji, on to you.
Yeah. So thanks, Dr. Saraswati. As Dr. Saraswati has just briefly mentioned, this seminar has been organized by ATMA, Boston Center of Excellence, and Friends of Madhya Pradesh. I'm one of the co-founder and director of Boston Center of Excellence and one of the core member or active member with Friends of Madhya Pradesh. So Boston Center of Excellence has been founded 4 years ago with a primary focus on integrative medicine, education, and leadership development. We are working on bringing the modern medicine and alternative medicine together and bringing the best of both the worlds, that is the best of the East from India and best of the West from USA. BOCE, that is Boston Center of Excellence, has memorandum of understanding to work closely together with 17 prominent universities in USA. That includes Harvard, MIT, Johns Hopkins. Also, we are having very active partnership and working relationship with AIIMS Delhi and SVASA. So, second organization is the Friends of Madhya Pradesh. The Friends of Madhya Pradesh has been formed by the Honorable Chief Minister of Madhya Pradesh with the main objective of being a bridge between the well-wishers, friends, and policy makers of Madhya Pradesh and India. This forum is to bring all the people together who are interested in working to contribute in social, cultural, financial, and business development of Madhya Pradesh. There are more than 11 active chapters all over the world who are actively working and making use of this wonderful platform. Friends of Madhya Pradesh chapters have provided help by providing various essential commodities, equipments to hospitals and doctors during the first wave and the second wave of the COVID. We are working actively under the guidance and mentorship of Mr. MOHAMMAD SULEMAN ji, and my sincere thanks to Suleman Saab and his entire team for the help and the support that they have provided to all the NRI parents and NRI relatives who are in India during both the first wave and the second wave. Thank you, Suleman Saab, for that. We have with us today two eminent personalities from Madhya Pradesh and India. One is Mr. Mohammad Suleman, who is the Additional Chief Secretary of Health for the state of Madhya Pradesh, and Professor SARMAN Singh from AIIMS Bhopal. It's my privilege to introduce our main speakers. I'll start with Suleman Saab first. Mr. Mohammad Suleman is one of the senior most IAS officers of Madhya Pradesh from 1989 batch, and currently working as the Additional Chief Secretary for Public Health and Welfare, Medical Education, Bhopal Gas Treasury, and Overseas Indians. Earlier, he has handled many important portfolios like Commerce and Industry and Energy. Madhya Pradesh has made significant progress in industrial development and energy sector under his vibrant leadership. He handled the COVID-19 crisis by proactively taking steps to contain the spread of diseases. The state of MP recently recorded highest dose in the country in a single day on 21st June. The vaccination program is extremely well executed in the state. And today also, Suleman Saab was extremely busy with handling the COVID issues. But once again, thanks to him for joining us on such a short notice. He is credited with widely acclaimed Madhya Pradesh power sector reforms in 2010 to 2014, resulting in the state transforming from power deficient to power surplus, implemented in a very short span of just 4 years, and that power reforms have become the success story for all over India. I can continue for more than 15 minutes with all his accomplishments and his contribution for Madhya Pradesh and India, but I will take a pause and once again welcome him to this event. Thank you, Suleman.
Oh, that's quite embarrassing for me. Thank you so much. Thank you.
Thank you. We also have one of the most well-known and accomplished doctors from Madhya Pradesh, that is Professor SARMAN Singh. Dr. Singh is presently Director and Chief Executive Officer of All India Institute of Medical Sciences, Bhopal. He has worked at the All India Institute of Medical Sciences, New Delhi for 30 years in various faculty positions. He has 7 patents and 1 technology has been commercialized for Kala Ulcer elimination program. Professor Singh is fellow of more than 7 national and international academics societies, including Royal College of Pathologists, Royal Society of Chemists, and many international scientific bodies. He is editor-in-chief of Journal of Laboratory Physicians, academic editor of medicine, and he's on many other editorial boards. He has been awarded several national and international scientific bodies for his outstanding contribution. The most relevant award is the Pride of India from the Public Relations Society of India for his work in the COVID-19 area. Professor Singh has already taken and guided more than 46 research projects. He has 20 more PhDs that he has guided, 16 MDs, and more than 40 MSc students are currently working under him. He has written 6 books and more than 325 research papers. Once again, it's an honor to have both of these gentlemen joining us from India in this roundtable discussion. Thank you. I now once again request Dr. Saraswati ji to introduce Dr. Mary ASHUR and other prominent doctors who have joined us in this conference. Thank you.
Thank you. Thank you, Pramitji. Thank you, Sulemanji, and thank you, Sharmanji. We really appreciate your time. So I have Dr. Mary Lou ASHUR here with us. She's an internal medicine physician here at Beth Israel, affiliated with the Beth Israel system and also with the Harvard system. She's the president of the Norfolk Medical Society. More than this, I do have to say, she's a very, very compassionate and compassionate physician. She's very proactive, very compassionate, highly educated, and whatever she takes time every day to learn something new, and she puts it into practice. She's a very strong patient advocate, I should say, and excellent orator. She does excellent presentations. She has a lot of experience in working with patients, not only at corporate hospitals or big hospitals, but also in outpatient healthcare system here. And she's an advocate. She's an advocate for every patient who comes our way. And we all feel blessed to have her in our lives. She's a very good friend, and she's a role model for me. So Mary Lou, thank you for joining us today. Thank you. Thank you. And we have Dr. Malika Kamna here as well. She's an infectious disease doctor. She's been practicing infectious disease specialty for the past 17 years in a multi-specialty clinic in Houston. I called her yesterday to see if she can give her expert opinion because she's been taking care of COVID patients and she has some experience in post-COVID fungemias after medications which are received for COVID recovery. So we appreciate Dr. Malika Kamna also joining us. Thank you, Malika, for being here.
Hi, thank you.
Thank you. And so our first speaker, what we thought about today was Dr. Sharman is going to say a few words, share his slides, and he's going to give an overview on the COVID scenario and COVID recovery in India in brief. I know we can't put it in a nutshell, so much have gone on in our lives. It's really hard to put it in a nutshell in 7 minutes or 8 minutes, but that's what he's going to try and do. And Dr. ASHUR will give an overview about what it's been like for us here in the US briefly. And then we're going to open the panel for asking questions to Sulemanji. Thank you. And the rest of the panel as well later on. We'll come back to the roundtable after that. Thank you. Dr. Sharman?
Yeah, can I share my
name? Sure.
Yeah, allow me. Allow me sharing, please. Yes,
yeah, Doctor. Yeah, I gave access to you. Could you try now?
Got it.
Yep, thank you. Let me know if I want to share the same slide from my side, if you face any problem.
That will be better because I'm finding some problem.
Yeah, let me do it. 1 minute. Let me share my screen. I already opened the document. Okay, got it. Okay, share screen.
So actually, I will try to finish, rush through some of the slides. As Dr. Saraswati said, I will try, so you can continue. Next, please. Yeah.
Sharmanji, we're always going to come back to your slides.
Yeah, sure. So, all right. So we can move forward. Yeah.
Sure. Thank you.
Next slide, please. Yeah. So we know that the frequently observed complications, which is probably today's topic. So in nutshell, what happens when a patient, we notice that, complications are coming up and the patient needs hospitalization. So the most important is obviously the pneumonia, then mucormycosis, which I will be dealing with little, later on, and then cardiac complications, which are usually after the patient becomes all right. Various kinds of things they are being noticed. I am sure that in USA also, and India, we know that arrhythmias, tachycardia, and various other complications, they are noticed. Also, the most important thing is that stress and psychological issues, they are coming up because of various reasons, because many times it is because the patient, they themselves, they are sick. And otherwise, also when the family members that they are sick, and we know that in April and first 2 weeks of May, what was the condition? So everybody was really concerned that what will happen, my relative or my wife or my husband will be able to survive or not. So huge amount of the stress, and that is leading to psychological complications. It is also told, and there is a documentation that there are also people are noticing that after a few months of the recovery, so other than cardiac complications, psychological complications, there people are also complaining that there are few patients, they are having hearing impairment. There is also well-known phenomena that they also lose the taste and smell. And our ENT colleagues, they say that the taste and smell, sometimes it is taking months together to come back. So that is, these are some of the sequelae and complications which obviously we can discuss later on, but today I will be focusing mucormycosis and an overview. So next, please, can I have the next slide, please? Yeah, so maybe previous slide, so this was probably the most important, some of the species. Many a times, this is a misnomer in India. This is, everybody says it is a mucor, and black fungus. Actually, if you see, about 90% cases, it is rhizopus. Mucor is about less than 10%. So, but unfortunately, misnomer is so famous in India that everybody talks of the black fungus. There are other species also, but definitely mucor comes number 2. The rhizopus is the most important. Can I have the next slide? So why it is, this is a common saprophytic fungus. Usually many of us, they know that, maybe in USA, probably you may not be knowing, but those who are from India. So definitely we know that, rotten wood and other things. We get sometimes the white cotton-like, growth. Next, please. And then what happens that, slowly when this is a little older, next, please. Then it becomes, the sporulation leads to coloration. So the spores of the mucor, rhizopus, FCT, all the classes, they are usually black in color. And that is the reason that this cotton-like, white cotton-like thing, which turns to black cotton kind of things. So that is the reason probably the common name, people started calling it as a black fungus. Next, please. And then what, these are the spores. The good thing is that usually the mucormycosis is not transmissible from patient to patient. So this is very important, and we keep on, teaching the, patients and their relatives, because, when the black fungus or the mucormycosis cases, they started coming up, everybody was worried that, what will happen that other patients, they will get infected from the infected person, and it can go to uninfected persons. And then obviously this becomes very important. Usually the disease invades, and that I will show you some pictures. Next, please. So then regarding the incidence, if you see, it is not a very common, disease, even though it is a, so it is reported that, the per million, if you see, this is, like in Western world, it is 0.005%, 5 per million, and in Indian and Asian countries, it is about up to 1.7 cases per million. The exact incidence in mucormycosis in India is not known, but definitely we know that if you compare from America or European countries, the publications and reviews and meta-analysis, they indicate that in India, it is almost 70 times more than any other country. So that is probably the reason. And then what are the various the risk factors? We probably, next slide, we know, but still, next, please. And this is again to incidence. So this is, so far, if we see the Indian Express was the recent, I Googled it, and yesterday I found out that 27,000 cases are reported as per newspaper and the news channels. But if you see the publication, there are only 82 cases which are published and documented in a peer-reviewed journal. Before COVID, we know that, as I said, that it is not a new disease. We know that, for decades, 40 years also I read in my MBBS time. So there are cases, there were about 1,400, more than 1,400 cases in adults. And it is these days, many channels and many newspapers, they say that for the first time we are seeing that in children with COVID, they are having, it is not true. The earlier also, there were cases in pediatric cases. So now, of course, the number has increased, but this disease infects all age groups, all genders, and it is known for decades. But of course, the number of mucormycosis increased significantly after COVID. So the most important predisposing factor is diabetes mellitus type 2 uncontrolled, and that too if the patient is having ketoacidosis. So it is seen that most of the studies, they indicate that, as low as 55% to as high as 90% cases, they will have, mucormycosis. And on top of that, if the corona also, which causes immune suppression, and the patient is given the steroids, then obviously this is almost 99% or 98%. So that is the reason. Other than diabetes mellitus, there are other conditions which are known, like the hematological malignancies and other things. Next slide, please. Can I have? So the common route is inhalation. So we can see that usually the most common the source of or the growth or spores is the your kitchen garden or around your houses. So the rotten wood is the commonest source of the spores. And what happens, that the reason that probably most of the patients, when they are going from the hospital, they are discharged from the hospital. When they are going, they are little relaxed, and then family also, they enjoy a little bit. Then they are also not following the appropriate behavior. So it is seen that majority of these patients, they are getting infection when they are going back from the hospital to their houses. So that is the probably reason that makes sense. And the findings also, they are they incorporated in the previous dictum. Next, please. And then what happens that once this is inhaled, next, please. So once it is inhaled, obviously this this doesn't remain. Obviously, the first filter is our cribriform plate, which is in our nose, and then it goes, obviously. So everybody's medical people, they know that how it goes, and then ultimately the spores, they settle in the lungs. And from lungs, if your immune system is not potent enough, these cells, usually the PMN cells and other cells which take care otherwise in normal conditions, they will not be able to. So then what will happen, that it will have the septicemia and the fungemia, what we call. So then it can cause disease in any other organ. But usually, as I said, the primary sites of deposition of the spores is the nasal route and up to lungs. And then that's what we see, that most of the infections and most of the clinical conditions, we see the various forms. I will come next, please. So this I have already covered. Next, please. So what various forms I will. So the most important and most common is rhinoorbital. So as I said, that the source and the route of inhalation and the route of deposition of the spores is obviously the nose, and then it goes to the orbits. So rhinoorbital is the most common form, and then it can migrate up to the brain. So then we know it rhinocerebral, and then it can have pulmonary, and then gastrointestinal and cutaneous, and then of course it can also have disseminated. Next, please. Now, what happens that usually typically the rhinocerebral cerebral mucormycosis, this usually the most common symptoms are uneasy feeling in the nose and one-sided facial swelling, then headache if it is gone up and migrated to brain, then nasal or sinus congestion, and then of course if it is very fast growing. So within few days it will lead to devastating disease condition, and then obviously within 2-3 days, if it is not noticed, not treated, then it will have black lesions on the nasal bridge or upper inside the mouth. That's what we call the palate. And then of course, fever is one of the subsidiary, and then complications are there. The next, please. So the pulmonary mucormycosis, usually this is the one of the, I would say that most misdiagnosed condition, because usually the most corona patients, they will have otherwise also the cough, they will have fever, they also have the chest, pain and shortness of breath. And also if they are having bacterial pneumonia or other pneumonia, so this is probably the condition where we will find that very few cases are documented and they are published. The reason being that most of these cases, they are not diagnosed correctly because they are having already other conditions. Next, please. So then if it is a gastrointestinal, then obviously you can have abdominal pain, nausea, vomiting, diarrhea, and just like any other, it is a site-specific manifestations. Next, please. Then it can also have other sites involved like cutaneous. It can have pain, warmth, and excessive redness, and then of course the swelling, and then dissemination. So dissemination, when it's really something very serious, and usually if there is a disseminated mucormycosis, then it is very difficult to treat because you require very high dosage of amphotericin. Next, please. These are some of the figures from our institute, our colleagues. So here, this is, very early lesions here. They have then, this is a little bit advanced here. And then this is blackening, you can see. Next, please. So here, when this is a very much advanced, that palate you can see, and then the whole palate is gone. So that is the condition. And here you can see the teeth and whole of the mouth cavity, they are involved, and then blackening all around. Next, please. So fortunately, there is a medical treatment available. I will not go into detail, but definitely this is oral as well as IV drugs are also available. That is something consoling, but in India, we know that the drugs are not available. Otherwise, medical treatment is available. But the medical treatment will be successful only when the disease is diagnosed early. Otherwise, you have to take surgical intervention, and most often it is seen that you have to remove either the some of the part, like usually the eyes are commonest, which you obviously cannot restore. Next, please. Now again, as I said, disseminated, and then it can, go to any site, and it can involve anything. I think next. So then, of course, the prevention, probably we can escape. This is the last slide in any case. So obviously, these are the precautions which are usually successful and useful in preventing any respiratory infection, including the corona. So there are usually the same methodology or same the guidelines which are which prevent corona infection. They will also prevent the mucormycosis. There are various theories why there are probably that we will come into discussion when we are question answer, because that will be the most important question, why we are seeing so many mucormycosis cases in COVID in India. So probably I'm leaving that answer to be discussed when we discuss the question answer issues.
Thank you.
With
Dr.
that,
Saraswati,
Saraswati, I couldn't thank you in the beginning, but now because you said that I have to be little, So once again, thank you very much, Dr. Preet, Dr. Patel, and other colleagues, those who are organizing. Thank you very much for giving me this opportunity and sharing the dice with Suleman Sahab. Earlier also we have been, but again I would like to listen him. Thank you.
Thank you.
Dr.
Thank you.
Saraswati, before you take up any other issue, let me just give a public health perspective purely on mucor, if you allow me 2 minutes.
Sure. Absolutely. Absolutely.
Those pictures, definitely create a different kind of a image. We heard of this disease sometimes in last week of May. For the first time, there is something called mucormycosis and something which is related to COVID. And obviously, this came as a kind of a new phenomenon. And, the medical community created an image which was quite stark and quite scary also. I was told that the death rate of mucormycosis is going to be 53%. To be absolutely precise, 53% was reported that this will be the fatality rate of mucormycosis, and we need to really do something about it. I was also told that there are hardly any medicine available because this is not a very prevalent disease. So in Madhya Pradesh, we used to have around 4 to 5 cases per year. So there are very limited supply of medicine which was available. And I contacted the most of the manufacturers, Sun Pharma being one. And I know the owner, he told me that he might have around 2,000 vials of that injection, which he can get to me. The rest, everybody has to look for himself and then find out resources where from we get it. Let me tell you now, how has it played out for us? So the situation is that so far in Madhya Pradesh, we have had around 2,100 cases of mucormycosis, both in the government and the private sector. 2,100 from 4 or 5 cases yearly to 2,100 in last about a month's time. We have been able to successfully discharge 1,283 out of them, and the rest of them are in some of them in hospital, some of them obviously didn't survive. 2 of my medical teams, one from Medical College of Indore, one from Medical College of Bhopal, did data crunching, put up lots of reports. And I'm happy to say that the fertility rate, which was supposed to be 53%, turned out to be only 7.5%. So that's the kind of a difference. Not to say that the earlier data was wrong or earlier projections was wrong. Very quickly, we realized in Madhya Pradesh the only way to deal with this is to somehow identify the patients early, identify them when the infection is only in their nasal cavity, and do something which, a technical word which I don't know, some kind of a surgery in their nasal cavity only, and then give them medications, and then they will be fine. And my medical team from Medical College of Indore did a fabulous job of it, creating a treatment protocol in time, trying to motivate the doctors community in the medical college hospitals and also in the private sector. We didn't have a single bed reserved for mucormycosis. In no time, Medical College of Indore could put up more than 200 beds specifically for mucor patients. Medical College of Bhopal could put up more than 100 beds. 5 medical colleges came up with a specific unit dealing with this disease and worked their heart out day and night to manage the epidemic. We could import a medicine right from up to US. We could track a plane landing in Bombay and then putting our own charters in Bombay to get those medicine back to Madhya Pradesh and then taking them to far off places in Madhya Pradesh. So fortunately, or whatever way, the things have not been as bad as they were protected. One of the primary reasons that government had to make extra effort is prohibitive cost of treatment of mucormycosis. Up to 60 injections are given to one patient. Obviously, the cost becomes it's not really manageable for a middle class family. In all my government hospitals, we treat mucor for free. In fact, almost 80% of the cases have been treated by government medical college, including All India Institute of Medical Science in Bhopal, and all of them have been treated absolutely free. And we also did a lot of research on why it comes through. Again, Medical College of Indore took the lead in trying to locate the source of it, and very detailed analysis they did finally to come to this conclusion that by and large the disease is limited to patients who are primarily diabetic, got COVID, had a sugar problem, and were given steroids in an uncontrolled atmosphere, either in their home or by people who were not supposed to be doing that. And that was the primary reason. Very quickly, we could create understanding that steroid cannot be used in home settings and they should only be given in medical supervision. That also helped. So this is the kind of a public health perspective of mucormycosis. I know I have limited time. To me, if you allow me a few more minutes about talking about COVID, I would also touch about how we have dealt with the second wave, and to us what the post-COVID actually means. Can I continue for a few more minutes?
Yes, yes, absolutely.
Okay. So let me say that we first wave of COVID in Madhya Pradesh was sometimes in mid-September, and at that point of time, I think the date was 12th September or something like that, and the maximum that we touched at that point of time was around 3,600 cases, and we thought we have seen the worst of it. Nothing more can happen, and that's it. Nothing more can go wrong. Towards the beginning of February, from that peak, we were down to around 116 cases per day. And, whole of Madhya Pradesh sincerely believed that we have seen the end of COVID. We have seen the back of it. There's nothing that is going to go wrong. Everything was kind of open, and everything was, every activity that was supposed to be permitted was permitted. There was nothing prohibited. The cases started rising towards the beginning of March. Still, the numbers are very manageable, so we were quite okay. Towards the end of March, we started seeing a very sharp rise in the cases. We hit second peak much before the India hit it. And for us, that peak was 4 times more than the first peak, kind of difficult for us to manage. India, of course, crossed 4 lakh cases. We were also somewhere around 14,000 cases. And then it also started coming down very sharply because of the restrictions that were imposed. The gap from the downside of the first peak to the second time when it started getting up was about 4 months, and then took about 2 months in coming down back to the normal situation because of all kinds of restrictions that were imposed in Madhya Pradesh much before rest of the country did that. We started enforcing lockdown in selected areas and also stopped economic activity, political, religious, and all kinds of activities were kind of restricted, and our cases started declining. I'm happy to say that today I have only 39 cases in whole of Madhya Pradesh. My positivity rate today is 0.05%, and there's absolutely no growth in cases. So we have reached a situation in which right now we are looking very comfortable. But taking cue from the last time when everybody thought we have seroprevalence, and Dr. Sarman Singh will happily agree with me when two of us would discuss and say that maybe we have seen the worst of it. But it was not to be. And because of Delta variant, we started having a problem, and then problem really went up. Now we have started something called Delta Plus also. And Dr. Sarman Singh tells me that it is even more infectious than Delta that we used to have. So we are again preparing that our cases might again start climbing up sometimes towards August, and we might again see a peak sometime in September. The epidemiology study that we have done tells me that the size of the third wave would primarily depend upon the restrictions that we are doing right now, and that will finally determine. And also large part of it will be affected because of the vaccination drive. So the current focus of the government in Madhya Pradesh is to prepare for this third wave. The first effort is not to let it happen at all. Not to let it happen at all so that the size is manageable. Second, even if it happens, we should have ourselves completely ready to deal with it. Last time we faced only 2 challenges. One is, of course, the oxygen supply. We don't produce liquid medical oxygen in Madhya Pradesh. That used to be a challenge. And second is an hyperbolic drug called remdesivir, which every thought is a sure sort recipe to deal with the COVID. These were the 2 challenges. And because we have identified challenges, I'm absolutely confident that we should be able to deal with them this time. We are already preparing for that. But right now, the focus continues to be not only on expanding our capacity. Ultimately, it's not really hospital, it's not really oxygen beds, and it's not really medicine that deal with COVID. It's such a wrong assumption to say that we keep adding beds and then we can deal with COVID. The reality is it's the doctors' community. It is the human resource that we need to have. We have to deal with a wave. Can we now again motivate our doctors to deal with a further challenge? Can we motivate the nursing staff that we have, that they should again be ready to deal with the challenge? That is the primary thing in my mind. And right now our focus is to prepare our manpower again to deal with the challenge, especially in the field of pediatrics, that we believe that some of the cases might start getting up. Second is to reduce the size. We are focusing on vaccination. In a day, we could put 1 million doses in Madhya Pradesh, and we continue to reach that. Our vaccination effort has also been very targeted. I am happy to say that a city like Indore, which for us is the center of epidemic, has always been a center of epidemic. We have already covered 70% population with at least 1 dose of it. And we believe that that would be a great help. Bhopal has also done about 68% of population with 1 dose. So the urban center being vaccinated would definitely help us in reducing the size of the wave, even if it comes. We also have now 8 cases of Delta plus variant. My medical friends tells me that out of 8, 2 actually died. And the reality is that both of them were not vaccinated, not even 1 dose. 6 of them, which were vaccinated by at least 1 dose, didn't need oxygen support. Some of them had to go to the hospital. 3 of them had to go to the hospital, but they didn't need oxygen support. And in fact, few of them were only with single dose of it. So we believe that the vaccination that we are doing should be effective in dealing with the new variant also, and should help us in reducing the size of the wave. So that's what we are in our post-COVID efforts and the way we want to plan for the future. I'm still available for some time if anybody has a question towards me. Otherwise, I'll have to seek your permission to let me go. But I'm ready for some questions if anybody has anyone.
Thank you. Thank you so much, Sulemanji, for all that you're doing, not only for Madhya Pradesh, even for the Indo-American communities here in Boston and throughout. We actually thank you for your help in few of the Indo-American communities here wanted to send oxygen concentrators and everything. So you helped us with the process, mainly to the town of Vidishi as well. So we really appreciate you for all that. You're doing an amazing job. You seem to be such a great role model for the rest of us to follow. And we thank you for that. But the vaccinations, right? You hit few points. I just wanted to ask few things regarding what you just said. It's to do, you spoke about the success Madhya Pradesh had in managing the COVID patients and also the Delta, but the Delta Plus is also coming now, right? And the future, as you said, you want to keep it a zero COVID-free state, totally. And if things happen, Madhya Pradesh team is getting geared up how to face the second or the third wave, if at all it happens. And the vaccinations, that's one thing. And we are so proud that 70% of your patients or the people there got at least the first dose. I think that's the main key. The vaccination is the main key. And the other thing is, there is a thought process that kids could be more affected in the future wave, but we are still not sure. I think it's something we have to wait and see. But if the people are getting vaccinated, I think the spread will be way less. And that way we can actually save ourselves and also the future generation. That's what I feel. And so anybody has questions for Sulemanji? Before you leave, Sulemanji, I just want you to hear the American perspective. So Dr. ASHUR would just briefly, very, very briefly share her thoughts on COVID recovery here in the US. Otherwise, we can't, you're so busy, we can't get hold of you after this. So if you don't mind staying for a few more minutes, we would really—
Saraswati ji, this is Rajesh Kakani.
Yes.
I'm founder, president of MP Medical Alumni Association of North America.
Okay.
I also am very involved with Friends of MP in New York, New Jersey.
Yeah.
Very nice.
We were instrumental in starting the Friends of MP back when Honorable Chief Minister and Sulemanji came. I just have a couple of questions for Honorable Sulemanji and Dr. Singh. So, I sit here and I talk to my friends in Indore every day. The question to you, sir, both, is what can we the people, physicians who have roots in MP, based in USA, can do for MP and for you. The problem has been, it was such a thing. And by the way, I want to thank both of you for managing this very unusual, unprecedented situation. But question is, what can we do to help? And number two, this FCRA, which is sorry, I was riding a bike. Okay, I apologize. Thank you, Saraswati ji, for organizing. So the second question is, this FCRA kind of restricts us from sending financial help to people in MP and in India. Of course, we have sent money through other organizations, but they have gone to Delhi, Ahmedabad, and Mumbai, and I would like my money to reach Indore. So please, if you can, set up a list of organizations in India, MP, who are registered to receive foreign donations. If you can put that up somewhere, that would help us in the future. Once again, I want to thank Dr. Mupana for organizing, and thank you, Honorable Sulemanji, and thank you, Dr. Singh. And I'll take my answer off. Thank you.
Thank you. Thank you so much.
Well, this Friends of MP has been such a fabulous support for us. During the mid of epidemic, Honorable Chief Minister found time to engage with the Friends of MP chapters across the world. I think 8-9 countries we could put together and interact with them. And most of them have been so helpful in arranging things for Madhya Pradesh. I can't thank them enough for their generosity. We also remain in touch with them. Some of them get into issues here in India. We try our best to help them out and see what we can do to ensure that they are not inconvenienced because of things here. I think this issue of organizations who can receive donations from overseas is under very active in consideration of a relevant department of the government. Prameet, I assure you, it should come through very soon, and we would put it on the chapter page of the Friends of Madhya Pradesh, so that anybody who wants to take advantage of that can do that. But a lot of people have reached out and provided support in terms of oxygen concentrators, in terms of medicine, in terms of testing kit. Actually, lots of them have really helped us out, and I'm grateful for all of that. Thank you.
So, Suleimanji, I do have to mention one thing. Recently, actually, COVID-19 Tamil Task team, we sent 1,000 kilos of PPE kits to, they've reached through Delhi, they've reached Chennai. But it was a challenge for us to go through the whole process from one charity organization here to another charity organization there, saying mainly it's PPE kits. So they're not, it's not like an oxygen concentrator where a few things are weighed off. With the PPE kits, they feel the availability is there. But then we weighed the pros and cons and the dollar value and the money value, and we felt it would be really beneficial to reach thousands of people across. So I think that list would be really helpful for us. So
sure.
I want to thank you for that. And we also had a meeting with Senator Ed Markey here in Boston, which Pramadji and others have joined as well. And we are actually working on sending supplies. Again, not only like the black fungus medications. We've asked for more vials, of course, the vaccines, which have been authorized by the White House, but then we are working on other things, how our local states here can help us, the Indo-American communities, help us to help more to India when it's a time of need, and also vice versa. We might also need help from India too. So it can go both ways. So I think it'll be really helpful to establish all these connections for future. So we really appreciate that. So Pramadji, go ahead. I see your one. Right.
Yes, so just a quick suggestions or thoughts to be shared with Suleman Saab. Sulemanji, we are here sitting in Boston, and which is the innovation capital of the world. There is a MIT Postdoc Association, there is a Harvard Postdoc Association, and there are a lot of cutting edge technologies and innovations that have come up in last 1 year, which can make the entire COVID treatment affordable, accessible, and improve the quality. So if we could form a forum where few doctors and scientists and policymakers from India and particularly from Madhya Pradesh can start interacting with these postdoc associations or couple of organizations in Boston and New York and few other parts, where we can once again act as a bridge to bring those technologies that will bring affordability, accessibility, and quality care to the COVID treatment. We can also think of creating a healthcare innovation fund where Madhya Pradesh can contribute a little bit, provide a platform, and there are so many private equity or venture capital guys who are right now more than willing to invest into healthcare. So just an initial thought, we can have a separate discussion on this and build on top of it. I just wanted to mention, because there are so many eminent doctors, professors, and friends of MP well-wishers here in this call. So just want to make mention of this thought, and we can build on it later with your guidance.
Sure. Sulemanji,
We will take it up, Ramiji.
Thank you.
I wanted to add one more thing as well. You were mentioning about the healthcare workers there getting tired and how to get prepared for the third wave. If there is such a thing, as Pramudji was saying, we can form a task force, and I would love to include Dr. Mary Lou ASHUR as well in the task force. And we've been doing that for other places in India, where we do teleconsulting and patient to patient and patient to doctor as well. So something to think of in those terms also. That's what I wanted to say. And we have here, we have the ex-chief commissioner, election commissioner of India, O.P. Rawatji. Yes, and we also have the collector of Panna, Madhya Pradesh, Mr. Sanjay Mishra, and Dr. Balram, who's the chief editor of Ayurvedic Journal of North America and the head of Boston Center of Excellence, join us today. And he's the dean of UMass Dartmouth as well for chemistry. Thank you.
We also have Dr. Mrinalini Sawal. She was the special secretary and a senior IAS officer in Delhi. She was heading earlier the health and Ayush department in Delhi. She has also joined us. So there are many other prominent personalities who have joined us on this call and will be very helpful to take this collective work forward.
Right. And Sulemanji, 3 more minutes of your time, please.
I'm available. I'm hoping for Dr. ASHUR to say something.
Yes, Dr. ASHUR, please.
Well, thank you. Thank you. I will be very brief. Maybe it will help actually if you pull the slides up. We don't have to go through them all, but it will help focus us a little bit. So go ahead and pull the slides up. I really applaud your efforts. My heart goes out to you because this is what we experienced in the United States. We go through these waves. It's incredibly, incredibly intense. We've really never seen anything like this before, because there is a transmission of this disease from completely asymptomatic people. And that becomes really very, very challenging. And that's why getting everyone fully vaccinated is so critical. Next slide, please. So what I was asked to talk about was a little bit about what happens after COVID. And after COVID and what people are experiencing really depends on getting beyond all of that critical medicine that we're seeing. There are really 3 groups, I would say: the people who've had COVID, other members of the society, and then, as was being acknowledged, that the stress on the healthcare system. These people are called, some people call themselves long haulers, post-COVID syndrome. Some people think of this post-COVID for some individuals as a multisystemic inflammatory syndrome. You can, next slide, please, where really people experience symptoms in many different systems, including their heart, their lungs, their kidneys, their skin, and psychologically. Many of the consultations that I've had and sent them to SARAS tend to be people who have had persistent complaints of pulmonary symptoms. And of these people, of a small study, only 89 survivors, 40% talked about persistent dyspnea that they self-reported. And of them, 19% had a reduced functional vital capacity, and half of them actually had chest abnormalities. Next slide, please. But beyond this, the other big system that I see a lot of are the psychological effects, like post-traumatic stress disorder. Sometimes it seems to be related to chronic fatigue syndrome. Now, this was seen before, back in 2003 when we had the SARS, what we thought was a terrible pandemic, right? Back in a long time ago with SARS, that many of those survivors experienced a chronic fatigue syndrome. And this is what we're seeing again. Maybe it's the same thing, but we really have diagnosable anxiety, panic disorder, post-traumatic stress disorder. Next slide, please. Other things that people just come into our office complaining of is just this brain fog and tiredness. There's a cardiac syndrome, almost like a Shy-Drager syndrome, where people have postural dizziness, and actually can be measured where their blood pressure will fall as they stand up, or their pulse increases, chest pains, difficulty breathing. Those usually go away. Next slide, please. But then there's a group that have some combination of these symptoms that persist for a long time. And it can be any number of these. And the interesting thing is, you can have the long COVID symptoms even after a very mild case of COVID-19. And if it lasts for weeks to months, we call it the long COVID, but most of the time it really goes away in 6 to 8 weeks. Next slide, please. This would be the breakdown. 1 in 7 lasts for 4 weeks, 1 in 20 lasts for 8 weeks. And then for about 1 in 50, it lasts longer, more than 12 weeks, and has persisted 6 months up to a year. Next slide, please. We actually have centers opening up in the United States to look at this at all the major hospitals, including Beth Israel Hospital, where Saras and I are affiliated with the Boston Hospital. There's also reporting to the CDC, self-reporting, which can include anyone through various apps. And it's through collecting, it's a new way of doing research really, where people self-report their symptoms. But we're learning quite a bit about it, even though we realized that men were more likely to be admitted to the hospital with COVID. We found that women were slightly more likely to suffer from long COVID than men were. Obese people had more likelihood, people with asthma had more likelihood, and older people had more likely chance of those long-term symptoms. Next slide, please. Vaccination. Some people report that they're actually better with their post-COVID symptoms after they get fully vaccinated. Next slide, please. And we're now vaccinating in this country down to age 12. This is the CDC site. These are the various symptoms studies that are going on. Anyone can participate. We invite you from India. Please participate. The more numbers we have, the more we'll know. Next. And so these are some of the sites where we're getting that information about long-term. Next slide, please. Here's the next, continue the fight, put your information in this. These are the tracker apps. Next slide, please. Then lastly, and we can stop here and come back to this. There are not enough psychiatrists anywhere to deal with the post-COVID, post-traumatic symptoms that people have had from COVID-19. So it's really becomes incumbent upon all of us as physicians and people involved in the healthcare system to really start to think about what can work to help people. So I just bring to your mind a little bit of the theory of cognitive behavioral therapy, that where people, how they think affects what they do and how they feel. Next slide will be my last. Where what happens, like with a PTSD kind of syndrome, is the symptoms coming in from your emotional brain, your limbic system, usually are thought about in the cortex, but if they're not, if people have been traumatized, either directly because of COVID or because of other social of health, such as poverty, or grieving or loss of people, or even for physicians, this kind of compassion fatigue, I'll call it. People can be very traumatized, and instead of that thoughtful response, it's more of that fight or flight brainstem survival response where people can have almost a panic disorder, breathing, heartbeat increase. So we can talk more later about using cognitive behavioral therapy techniques in every office to treat and work to help people recover from COVID. Thank you. You can stop the slides, please. Stop.
Thank you, Dr. ASHUR. I feel there are two aspects to look at it: recovery of COVID, the patients from a medical perspective, the families from a socioeconomic and other perspectives, and also the recovery of the healthcare workers. What we've gone through as a healthcare worker society, what we've gone through the whole process about a new disease, about a pandemic, and also how we are recovering. We are still recovering, I feel. It's a long way to go. So thank you.
You know, we're used to knowing what we're dealing with and being the smartest person in the room and really being able to affect change. And we can be just overwhelmed by the amount of what's coming at us and the kind of love and care that we need to give to patients while we're still experiencing the same thing with our own friends and neighbors and colleagues that are working hard and sometimes lost to this disease.
Thank you. Sure. Thank you very much.
As in this direction, Government of India has issued advisory that all hospitals, they will be having post-COVID clinics. So that is in this same direction, because many of the new symptoms or the sequelae, we don't know. The patients are coming slowly and slowly. You know, after 1 month or 2 months, we say that everything will be all right. But some of the patients, they are coming after several months. So
That's
obviously,
right.
for that reason, Government of India has, you know, advisory issued that all hospitals, they will be having, and to begin with the central government and then probably state government also, they have to start post-COVID clinics.
Yeah.
Right. As a pulmonary.
Dr. Saraswati, if you permit me, I will have to leave now.
Sure. Thank you. Thank you,
Is that-
Sulemanji. Thank you so
Suleiman.
much
No,
for
I'm-
your time.
Thank you.
No, let
Thank
me
you
just
so much for your time.
thank you and Prameet and American Tamil Medical Association for inviting me over, and thank you so much. My colleague Dr. Sanjay Dikshit, who is the Dean of Medical College in Indore, is around. If anything specific to Madhya Pradesh, I am sure he can handle this. Thank you very much.
Thank you. Thank you so
Thank you.
much for your
Thank you,
time
Suleman,
and
sir.
all that you do. Thank you. We appreciate that. So, Dr. ASHUR, so I just had one question for you. I think Dr. Malika is also here. Dr. Malika,
Hi.
hi.
Hi, Dr. Saraswati. Hi, Dr. ASHUR.
Thank you. Thank you for joining us. I wanted to share, could you share your experience about post-COVID infections, especially to do with the fungemia, please?
Yes, I've been taking care of COVID patients since the beginning of the pandemic in southeast part of the Houston, in several hospitals, including acute care hospitals as well as long-term acute care hospitals. So patients who have been recovering, who has respiratory failures on the ventilator, then the tracheostomy, and the slowly weaning down on the steroids. So we have used a tocilizumab, interleukin-6 medication. So we have seen quite a bit of we did see quite a bit of fungemias and fungal infections in the lung, cavitary lung lesions. So, and that was my experience we had, and the post-COVID, like what they said, we've been seeing like more of like a PTSD, chronic fatigue syndrome, and also more of like anxiety, panic attacks after a few months, even after few months after post-COVID recovery. Not only long haulers, we have chronic dyspnea, the patients who never had any lung problems now dealing with the chronic dyspnea. And so we've been dealing with that as well. And other than the fungemias, candida infections, not only regular candida and the non-albicans candida, as well as we have a couple of aspergillus pneumonias we have seen, that is from the tocilizumab, we thought, and we have seen mostly in the tocilizumab patients and the steroids and the long-term use of, they have recurrent bacterial, secondary bacterial pneumonia. So we had to use antimicrobial agents, and that we have seen those in patients. So that is my experience. We have not seen rhizopus or mucormycosis so in Houston, but we have seen fungemia infections so far, and a few patients have come to that also. And that's an excellent presentation by Dr. Singh about mucormycosis. As he mentioned, the rhizopus is the most common one, and that's an excellent presentation. We always get all the articles and about the mucormycosis, about rhizopus from India. So thank you for inviting me for this excellent roundtable conference meeting.
Thank you, Dr. Malika. You know, as a pulmonologist, I've seen only 2 or 3 cases of invasive mucormycosis in the lungs in post stem cell transplant patients while I was doing my fellowship at Sloan and Cornell. I've not seen the black fungus like what it is, what India has experienced. So our knowledge here is kind of limited, but then now everybody seems to be, my patients here in the US, they are Googling and finding out, reading more about black fungus. What is it exactly? What is going on?
So Dr. Saraswati, here is my question, because probably that is, that will educate us also. As I said in my presentation, we are trying to analyze and we are trying to learn. One is, of course, what we think that the indiscriminate, I'm using the word indiscriminate use of steroids that was used even in the home isolated patients. And even our medical fraternity, they also used to say that go to chemist shop and get the steroids. So probably that, I just wanted to share this experience from India, and, whether the steroids, they were used hugely in US also. And if not, then obviously this proves that, the steroids were the main culprit.
If I can add in, we have not been using quite a bit of steroids. We're very quickly tapering it. That could be the one of the reasons we have not seen any fungal infection so far. I think that I have come across from the family and the friends in India, and they are going to the medical shops and getting the steroids. Not small amount of steroids, quite a bit unsupervised use of steroids. I think that's contributing to it, and high blood sugars and ketoacidosis. I think that's one of the key factors.
Right. Dr. Dikshit, you're from Indore, right? Hello, Dr. Dikshit.
Hi.
Dr. Sanjay Dikshit. So I wanted to find out his experience from Indore.
He was here, but probably it seems that.
So we have Dr. Jayashree Sridhar here. She's an gynecologist, reproductive.
Yeah, I'm not actively treating COVID patients, though I did deliver around 6 or 7 active COVID patients, and I've delivered post-COVID, and thankfully they've been doing well, like we have never induced a patient or anything just because she had COVID. So after COVID, they've had normal deliveries and C-sections or whatever, and they've been uneventful. Like, none of them had any severe thromboembolic episode or anything, or IUD. So, so I'm having a list of around 24 patients who were COVID positive, and out of which 8 had infection when they delivered. And the others, some are ongoing and some delivered after becoming negative. So they've been doing well. And as she said, this, steroids, over-the-counter preparation is very high. And some of the, Ayush doctors also, they're using 2 or 3 steroids. One patient's prescription, then some patients, they take the relative's prescription, or the relative became all right. Somebody is using Medrol, somebody is using Prednisolone, somebody is taking... So they're taking all the 3, not knowing that all the 3 are steroids. And also one more thing, my physician friend said that the second wave, the pancreatic inflammation was also very high. They had youngsters coming in on day 4, day 5 with sugars of 600 and all that, with no history of steroid intake. So the second wave, maybe the Delta variant or whatever was infecting the pancreas in a huge way. That was my friend's observation when we were talking on the OT launch that day.
Sure. Thank you.
Though my physicians might be able to throw more light. Yeah, I don't know anything about it.
Dr. Dikshit, Dr. Sanjay Dikshit, we can't hear you. So, Dr. ASHUR, so I see a perplexed look on your face regarding the multiple steroids used being one patient using 2 or 3 doses of steroids at the same time, not knowing they're all belonging to the steroid family. So just to give you an update, what happened was in my extended family during the second wave, almost 15 of them had COVID, and then they live in different parts of India. So by the time in 12 hours, by the time when I woke up, when I went to bed to waking up and later on, in 12 hours, by the time I came to know about it, the prescription from Andhra Pradesh was WhatsApp to one of my other family member in Bombay, and they shared the same prescription because there was no availability of doctors. The country was on a lockdown, and they didn't get access to physicians, and they started feeling the symptoms, and the fear is a big factor here. So they feel it's better to take the medications rather than not having access to healthcare system, not knowing where to go. They wanted to avoid hospitals. I don't think they were to blame, but they shared the prescriptions on WhatsApp and people were taking the same prescriptions. And I see Dr. smiling for that as well.
Yeah, education to people about how to deal with symptoms, as well as us trying to be available. In this country, we've had some luck with telemedicine, at least trying to be able to be responsive, but we've had to train nurses and had even in our office, the people who answer the phone, we've really had to train a lot of people who aren't necessarily healthcare workers on how to respond. But big public health statements, because early when our epidemic was terrible, we had people touting everything. We even had the president of the United States who was touting a lot of junk to take, and in this case, sadly, it could make people worse. So trying to educate people about how to care for themselves and what not to do is important. We're finding in this country right now groups of people who are afraid to take the vaccine and not for good reasons. I think it's really important to try to get the media to be a public health arm. It's not just what we put out, but now, even though we're in the information age, there's a lot of bad information out there. And so trying to help our patients and trying to really reach to so many levels of society to get people good information is part of our, needs to be part of our new public health armamentarium.
Sure. Thank you, Dr. ASHUR. Dr. Dikshit, can you hear us? Dr. Dikshit? I see Dr. Gurnath here. He's from Tamil Nadu. I wanted to see if he had anything to share on this whole perspective. Dr. Gurnath?
Yes, Dr. Saraswati. Long time, long team. I'm a urologist working in near Chennai, in Melbarvattur and Pondicherry. What we experience from a urology side is, we don't see much of patients other than the transplant patients developing few problems. Other than the pure core urology with a COVID patient, we have managed few patients. But the only part of for us as a urologist is only the anesthesia part, whether to give GA or not, whether to operate on the patient or not. The anesthetists are so worried. Otherwise, we don't see any urological parts or we face any difficulty. It's purely a pulmonological or physician's problem. Thank you.
Thank you very much. Yes, Pramadji, go ahead.
Yeah. So my question is for Dr. Sanjay Mishra, or Mr. Sanjay Mishra, who is the collector of Panna. He's also with us. So thanks, Sanjay ji, for joining us. I would like to ask Sanjay ji about his experience on how Panna is, I would say, tier 2 or 3 city we all might be knowing about Khajuraho, the world famous Khajuraho temple. So Panna is just 45 minutes from that place, and the entire district is managed by Mishra ji. So Sanjay ji, what was your perspective in tier 2 cities and tier 3 cities? What are the challenges, and particularly in the post-COVID scenario, how you are managing the challenges and how we would be preventing the wave 3, or what are the actions that you are taking? So if you could throw some light, that would be very helpful, sir.
Thank you, Pramit ji. Good evening to everyone. Really, as you said, that it's a tier 3 city, but it has advantage, it has disadvantage also. Being small, it can be dealt in, can be controlled in an easy way than dealing with some big city. What we are having the crisis, we were having the crisis of only medical manpower, because at times when we found our civil surgeon got COVID positive, our chief medical officer got positive, and his replacement also got positive. We were not having any leader in the hospital who can lead the team. And also we were having the crisis at some time that when the doctor's family got COVID positive, someone's wife, someone's father, someone's mother is positive, when the medical fraternity is under pressure, then how as an administrator I can expect them to deliver? It was very tough time for them. Actually, I wanted to ask this question also. I think Dr. Mary can answer it as well. When any person who is going to treat a COVID patient, he is under stress, then how he can manage his stress to treat the patients well? Because I organized a counseling session for my doctors who were treating in Panna. Our Commissioner Health organized a counseling session for the doctors. Kindly fight with this pandemic and make the ways to attend the patients. Luckily, I was, well, last year when I joined in August in Panna, in September, I felt that there might be oxygen crisis in future time. There was a oxygen plant which was closed for 2 years in Panna. I got that anyhow, that plant functional in October. And this time I did not face the oxygen crisis in Panna. Because my oxygen plant was in working condition, and I helped nearby 7 districts for the oxygen. So as an administrator, we have to forecast the situation. We have to know our strength, and we have to manage in the way so that if in future, if any crisis comes, then how you can handle. In Panna, we effectively manage the crisis of remdesivir injection also. Any type of crisis which was we were facing, in any way we managed with our team. That crisis never went to the public. There were crises, but we managed all the well, and it was dealt my team. How we managed it, once the public get there is a crisis, then they make the things more worse. Everybody asking for their safety, everybody asking so many precautions, everybody, so that there is a crisis of medicine, everything in the market. Once you say that we have medicine, we have everything here, we have sufficient amount of everything, then there is no crisis, then actually you can handle the things. And what you said that how we are dealing with the post-COVID, when the COVID second wave was going down, and we felt that there is mucormycosis that we call is black fungus, or some post-COVID complications. We have established, the government of Madhya Pradesh established COVID Command Control Center for last 1 year. We have a fully functional 24/7 COVID Command Control Center who is taking note of health of all COVID positive patients who are in home isolation. They are calling without any fail 2 times morning and 1 time in evening video call. They call video call the patients, how you are feeling, if you have any other symptom, if you have any problem, they advise them. If they want to be treated in the hospital, they want to visit the doctor, we arrange the doctor at their home. The same method we followed with this post-COVID. When we said we found that there may be some post-COVID complication, then from 1 March to 31st May, around 4,000 patients who were treated for the post-COVID, who were got either home isolated, either they were in the hospital. We put everyone on the call. Our team has called everyone, asking about their health, whether you have any black fungus-like symptoms, you have any post-COVID complications. We took note of every patient for the 1 week continuously, so that if we found any post-COVID, then we can bring them to hospital and treat them. Only one person we found that he said he is developing some black fungal-like symptoms. We sent an ambulance to his house. We brought him into the hospital. We got his checked, and luckily he was not having any. He was only panic. He was worried about the symptoms that he got from the TV news. So in that way, we handled the post-COVID complication, and we put a 20-bedded ward in post-COVID ward in our district hospital. We put a 10-bedded ward in for black fungus patients, and we also created 20-bedded ward for the children, pediatric ward, so that if we get some any infection with the children, how we can handle them. We upgraded our facilities so that we should be in the ready condition, because we don't know how the crisis will come. For this, yes.
But, Mr. Ji, our more how the village level setting, because lot of the NRIs who are here, if their relatives are in village settings, they were really worried and the help was not reaching to them. So for the village level setting, the sub-health centers or the primary healthcare centers which are in village setting, what kind of arrangement could be done in that scenario, and what help you need from the NRI community to strengthen that?
Yes, thank you. In that case, we were having a district corona management committee. We have some put prominent members or officers in their committee, and our chief minister has brought this committee to the village level also. Today now we have a village level corona crisis management committee. In that committee, we are having the all prominent leaders of the village, prominent retired teachers, prominent retired doctors, anyone who they are in the committee, and they are taking care of their villages. People of the villages were so aware that they put the display boards, please don't come to our village. They were put at their own barriers to maintain this curfew-like situation, so that any positive patient should not come to their village. If someone is coming from outside, once he get tested, only then he will be allowed to come into the village. If someone is coming from the Delhi or Mumbai into the village, he was put into the quarantine center in the village. After 14 days, he was allowed to move into the village. That is how the villagers were saved. And we put the mobile teams. The whole strategy to dealing with the COVID, as our chief minister has given a direction, we were working on the TTT strategy, tracking, testing and treatment. We found the mobile teams. The teams surveyed the whole village, whole area for the anyone having the COVID-like symptom, like some fever or some any other headache or some other. We surveyed them. Once we found the persons who were having a COVID-like symptom, then everyone was tested. We got 100% testing of the person, and who came the positive, either we isolated them, either we put them into the COVID command centers. We did this survey regularly so that we can find what is the spread, what is the content of the COVID. In that way, we every day our chief minister has given the Kill Corona Abhiyan. Means we want to we have to identify the corona, and once we isolate the person for 14 days or 10 days in his home in some COVID care center, then he will not be able to spread the corona to any new ones. In that way, we could effectively break the chain of spread of the corona.
Right.
That was the local, our lockdown strategy was this only, to keep the person who was infected, put him in isolation, put him in the hospital, so that for 14 days, if he does not goes out, then he will not infect to other persons. These are the strategies that have been followed with the villages, and we put a nodal officer for every village. Those officers were reporting directly to me.
Right.
If whether they want any, they see any environment that COVID can spread into the village, whether they are seeing any decline in the village, whether they were responsible for the whether people are not following the COVID appropriate behavior, like putting the mask, sanitizing, maintaining this social distancing. These things all were practiced not on the papers. This was practiced the actually. In that way, that is how we were able to control, because I was knowing the strength of my hospital. I was knowing the strength of, because not a big city, so we don't have very, we always have a referral kind of medical system. So we wanted the people, the spread of the COVID should be contained so that we can save our people.
Sure. Thank you, Panaji. Thank you so much for that. I think we're running short of time. So I just wanted to find out if Dr. Dikshit can say a few words on the indoor situation. And while we are trying to connect to Dr. Dikshit.
Hear me?
Yes, we can hear you now.
Can you
we
hear
tried
me?
to connect with you before.
Yeah. Yeah.
So
in Indore, we started getting, we started getting new cases in first week of May. And to start with, we have, as Suleman sir has said, we have right now 250 bedded, especially designated for mucor cases. We have a mucor board consisting of ENT surgeon, dental surgeon, and neurosurgeon, and physicians and ophthalmologists who see each and every cases and they manage. We also analyze the data of the mucor cases admitted. 93% were having a history of diabetes, and some of the patient doesn't even have the COVID history. So that's how we are managing. Till now, we have conducted about 1,200 endoscopy and 700 surgical interventions. So we have a mortality of about 7.5%. Right now, we have enough medicines to manage the cases.
Sure. Thank you. Thank you so much. Dr. ASHUR, Collector Panna was talking about the rural areas in India or in Madhya Pradesh, right? How to reach the rural areas for education and also communication and access to healthcare. Do you think we had any such issues here in the US?
Well, of course, every culture, every community is different, but certainly the response of different communities has been different. Yeah, so, and where people trust their information and where they go for their information is important. We're certainly seeing that with our vaccine rollout. It's very important for us at a public health level to have key members of the community that people trust and have faith in give important information out. I just want to add one other thing. We talked a little bit about burnout, and there's a few things I think that really help. One is allowing physicians or anyone working to have time off when they need time off. Another thing is teamwork, and I'm seeing beautiful examples of teamwork in India on all levels, and I encourage you to keep that up. And the third thing is, remember, the doctors and nurses have gone to this. I mean, we're really givers. We're really helpers. This is what we want to do. We really haven't been trained for this. We really never thought we were going to see, you know, a disease where it could kill us and our family members while we're taking care of it. That's not what we're used to. But by and large, in our hearts, we're healers and helpers. And just really acknowledging to each other. And I want to acknowledge to all of you that you're heroes. This is important work. It's what we were born to do, and it's what you're doing, and you're stepping up and doing it and really making a difference in the lives of people. So thank you for your work. I'll also say have hope. We're in this side coming out the other side of just a horrible situation, and it gets better, guys. Hang in there.
Yeah.
Definitely there's light at the end of the tunnel, and I think we're able to see it. And soon India is also, the situation is getting better. And we know a little more about what we knew 6 weeks ago. I think what happened was it came too fast and too strong. That's what happened. And but I feel all of us are better equipped now to take care of things. So Pramaji, did you want to say anything? It's
I would just like to check
10:30.
if I see Dr. Mrinalini also online. I'm not
Sure.
sure if she could speak for a minute or two to give her perspective, and then in next session we might have her as well to speak and share her views in length. So.
Hi, thank you, Pramit-ji. I happen to be here and I was too intrigued by this conversation to leave, although I have another meeting. I'm like, there was a lot of new facts which were brought to me in this meeting, especially regarding the mucormycosis or the black fungus disease, and also the post-COVID scenario which we are facing all over the world. And the very fact that we do not have enough psychologists or psychiatrists to take care of that. So that concerns me a little bit. And like you said, we were, like it was said just now, that we were like blindsided by the COVID wave in India. Nobody was prepared. Whether it was in India, it was not predicted even anywhere else in the world that India is going to face such a scenario. And we were blindsided. But I'm very happy and proud of the speed in which we could tide over that acute crisis. And now we are in a position to manage the current wave, as well as we are preparing very fast in case, God forbid, another wave is to take place. So I'm very happy that I was invited for this meeting. I'm enlightened, and I'm very sure that other people are watching this, or who shall be watching this in India and in other parts of the world, shall be enlightened about the current disease, acute disease, chronic disease, as well as post-COVID scenarios. So thank you very much.
Thank you, Doctor.
Thank you, Dr. Mrinalini. Thank you so much for that. You know, I run a pulmonary clinic as well. In my pulmonary clinic, I see a lot of patients post-COVID, young patients who are needing to carry their oxygen cylinders or portable oxygen concentrators. It's very disheartening to see the kind of scarring that COVID had left, not only in the lives, but also in the lungs. I mean, it's really disheartening. But there is hope. They're getting better. That's a good part. And I think we are able to recognize the COVID much earlier and treat them and keep them at home and treat them at home for most part. I think that's the best for early recognition. That's become a huge key. And prevention is the most important thing, as everybody, Dr. Sharman and Dr. ASHUR and Dr. Malika were reiterating that vaccination. I think that's the most important thing. If there's one message to drive home, really important to get the vaccination part taken care of, I feel. So any closing comments, Dr. Sharman? I know you have a lot to share with us. We're going to bring you back on another session. So
yeah, okay. Once again, thank you very much. I would like to thank you, Dr. Pramit, your team, and others, those who are here, especially your mentor, Dr. Patel. He commented. So thank you very much, Dr. Patel, and others, those who are hearing. Of course, the last slide, which I left, because the prevention is most important, and I think the probably we learned from the mistakes. So Government of India and our doctors fraternity also, we learned that the mistakes with some of our doctors, they didn't have any guidelines. So now Ministry of Health has issued the guidelines that steroids should not be used. There were very few in the doctors who were not advising the steroids. They were in minority, including me, but majority of the doctors, they said that no, the steroids is a life-saving, so we should give. And as you very rightly said, and others also said, that people were taking on their own self-prescription, and the chemists they were giving. So that was probably the reason, and that made this situation very, very worse. And I think that, for future threats, which is looming, I would say definitely, because the experience tells from UK and other countries that the third wave, probably you might have seen that the people immediately after the number of cases came down, people have become again complacent. They are going to markets, they are not using the appropriate behavior, they are not masking. So I think for that, it is also very important that new mutants are coming. So through this platform, I would like to request that if anybody, we are in the need of chips, corona chips. We want to have a lot many sequences done. And we have the all facility, we have the faculty, we have the lab, and we could do only 40, 50 samples, but we need more reagents, and chips are very costly. So obviously, if we can do timely and the sequencing, then we can contain these patients and the areas and the self isolation and quarantine these patients. But by the time what happens that these days the India is not equipped to sequence. So the time is taking about 2 to 3 weeks. By that time, the patient has already spread the infection, and that is really worrisome for me. Yeah. So with that, I once again thank you all.
Thank you, Dr. Sharman. Dr. ASHUR, any closing comments, please?
Thank you so very much. It's a privilege to be here with all of you.
Thank you, Dr. ASHUR. Dr. Pramadji.
I just want to thank each one of you, Dr. Saraswati, mainly to you, for all the effort and the tireless work that you are doing for so many months, not only just to treating patients, but to training the healthcare workers in America, in India, and continuing this bridge between India and US. So many thanks to you and to all the doctors, Dr. Singh, and the policymakers and the senior officers like Dr. Mrinalini, Dr. Sanjay Mishra, and all others, Dr. Sanjay Dikshit. Sorry, I'm not naming every one of you, but we are really thankful to the entire medical community, the healthcare community, and to all our senior government officials who have done a wonderful job and helping the society at large. Thank you.
Thank you. I wanted to say a few words about COVID-19 Tamil Task Team. So this is all started by the Tamil Task Team last year when COVID hit us in the US and through the world. And we wanted to learn from each other, from each other's experiences, what it's all about, because it's a new disease. And that's how the COVID-19 Tamil Task Team, this is one of the wings of the Tamil Task Team. They've filled around 5,000 prescriptions to stranded family members from across the globe here in the US, and who had no primary care physicians or no physicians. They came on visitors visa here, and they got stranded because of the travel policies, lockdown and everything else. So they did a tremendous job of filling around 5,000 prescriptions for such families. And so many other things COVID-19 Tamil Task Team has done, including helping out each other in this process and starting from finding food supplies to medical supplies to connecting people and getting resources. And also during the second wave, helping out so many people in India across 24/7. They work tirelessly. The whole team works tirelessly 24/7 to help out people who are in need, finding beds, finding ICU beds, finding oxygen concentrators, sending oxygen concentrators from the US to India, and also helping in sending medical supplies. And we want to thank Prem, who's our IT person here, who helped us put the whole thing together in terms of the technology, the flyer, and circulating it. So Prem, thank you so much. And I really thank American Tamil Medical Association and COVID-19 Tamil Task Team, all the speakers here and the audience, and Pramadji and Dr. Dinesh Patel. I did miss to say, Dr. Dinesh Patel is an emeritus professor in orthopedic surgery, especially in arthroscopy at Mass General Hospital. And he's the associate professor at Harvard Medical as well. He had to leave. So thank you again. Thank you, everybody. Prem.
Hi, I'm Prem Kumar, one of the volunteer from COVID-19 Tamil Task Team. So I really appreciate and thanks a lot to all the doctors, frontline workers, volunteers, our government administration, and they are working day and night for 24/7. And some of them even they couldn't have a time to spend with the family, and they are taking care of our people life. And we didn't expect this in our life, but this happened. But we all coming up from this current situation, and hope expecting we will be back soon, and we'll pray to the God. And once again, thanks to all the panelists, doctor, chief guests, and who are watching. Please continue and the same support and save our life and our people life. Thanks a lot.
Thank you. I want to thank Collective Panaji as well, and Dr. Sanjay Dikshit also. Dr. Dikshit, we are going to bring you back in one of our future sessions. Next week, we're going to take a break because the American Association of Physicians of Indian Origin have their national convention here in Atlanta. So we are going to take a little break. Thank you. Thank you, everybody. Pramaji.
Thank you.
Yeah, thanks. I just wanted to briefly mention the last comment which I missed, that with Dr. Dinesh Patel and Dr. Balram Singh, and there is a small team, we are working on making sure that the yoga protocols or naturopathy protocols that have been proven very effective in the post-COVID recovery. We are trying to work with the insurance companies and the policymakers here in US so that those yoga protocols should get approved insurance code so that they can be widely used. We have seen back in India as well as here that they have worked immensely very well and have a very positive impact on the COVID patients. So in this forum, I would request that whoever would like to support that cause, because more the better, and we would like to get the yoga protocols at least temporarily approved by the insurance companies for the COVID patients. Thank you.
Thank you, Pramaji. I know this was one of your questions to our Senator Ed Markey's meeting. We will definitely send it across to him as well to see what their team has to say.
Thank you.
Thank you. Thank you very much. Thank you very much, everybody. Thank you. Thank you, Dr. ASHUR and Dr. Sherman. Thank you very much. Have a nice Sunday. Thank you. Bye-bye.
Thank you, Dr.
Thank you all.
Thank you, Prem. Thank you.